Hello, this is John Ferreira from EXS46, and today's case study and presentation will be based on traumatic brain injury, or known as TBIs. Traumatic brain injury is known as a head or brain injury caused by a blow or strike to the head. Traumatic brain injury can also be caused by the skull hitting an object or an object piercing the skull. Examples of these could be related to sports. In football, when athletes collide head-on, there may be resulted in a skull fracture that causes a TBI. Or an example in real life could be a car accident or collision or something like that. Complications associated with TBI can vary from moderate to very severe based on the damage caused on the brain. So if you are on the more severe side of the scale of damage caused on the brain, you may face more difficult complications, while if you're on the moderate side of the scale, you may not face such difficult complications. I thought it was important to include a couple of traumatic brain injury statistics for people to promote awareness and for people to see the numbers behind this injury. 1.7 million people suffer from a traumatic brain injury every year in the United States, and about 5.3 million people live with a disability due to a traumatic brain injury. I thought it was really cool to see how many people actually really are impacted and affected by this injury. And then sports and recreational activities are responsible for 21% of TBIs in children and adolescents in the United States. This was really relatable because the field of rehabilitation that I want to go into is working directly with young athletes and children. So I thought it was cool to see how the correlation between that number and how people are trying to promote less contact sports and less contact activities in children at such a young age. 50,000 deaths per year in the United States are due to a traumatic brain injury. So symptoms of a traumatic brain injury vary on the severity of the injury, but most traumatic brain injuries have similar symptoms. Obviously, like I said, if you are on the more severe scale, you may face a couple more of these symptoms or the more severe symptoms listed, while if you're on the moderate side, you may not face some of the symptoms listed here. So a couple of the symptoms include headache, confusion, paralysis, coma, vomiting, lethargy, loss of consciousness, breathing problems, body numbness or tingling, and loss of memory. So obviously, if you're on the more severe side, you may face the complications such as breathing problems, loss of consciousness, or loss of memory, while if you're on the more moderate side, you may just face a headache or confusion or something like that. So the diagnosis of a TBI. Traumatic brain injury patients undergo rapid attention and care when they are seen in the emergency room or by a doctor, similar to other trauma patients. It's very important to stop that secondary injury to the brain, to stop any further injury to be caused as well. So the first thing that they will do is a cardiac and pulmonary function assessment, followed by a neurological and full body examination. I saw what was really prominent in all the research that I was doing with the Glasgow Coma Scale. That really tested the patient's neurological and consciousness level and makes that association between the two. And then there's obviously CAT scans or computed tomography scans, what they're better known as. They're the most used standard for radiological assessments of TBI patients. That will really get a look in there, kind of like an x-ray of what's going on. So they will detect fractures, presence of blood, or other crucial complications associated with TBIs. Medication and treatment for TBIs. The primary goals, like I mentioned before, in the emergency room and by doctors is to prevent that second injury to the brain. A lot of the research that I saw was that the doctors are really focused not on that initial injury, but on that secondary one, because that one can really cause neurological injury post-trauma. So there is no medication that I found that can heal, stop, or delay nerve damage after a traumatic brain injury. However, there is medication to help the side effects of TBIs. There's amantadine, and that may be considered to improve states of arousal, consciousness, and accelerate functionality in the patient. That works by working with the natural chemicals in your brain and restoring them to a normal balance, or at least to a balance of more functional level. And then there's methylphenidate, and that's for adults to increase attention and information processing. There's also dextroamphetamine, and that's used to increase attentional function as well if methylphenidate is not tolerated. So traumatic brain injury and exercise outcomes. So I really wanted to make that correlation between the exercise level in patients that suffer TBI injuries. So inactivity is very prominent in those who have suffered a traumatic brain injury, and that results in poor fitness levels and other health complications such as depression, anxiety, and stuff like that. Traumatic brain injury patients should use an exercise program and exercise regularly to improve health following a brain injury. Exercise can improve bad balance, bad coordination, it can help with functionality, and it can decrease the reliance on devices that developed after the TBI. I thought that was really cool because a lot of people, they struggle with the mental health issue when they rely on devices and stuff like that. People don't like to rely on that stuff, so it's cool to know that there's something out there that can help you not be as relying on the devices and stuff promoted in rehabilitation settings. Studies say that those with TBIs who did exercise reported being less depressed and experiencing better quality of life. So traumatic brain injury in the rehabilitation setting and how they prevent and treat that. So depending on the severity of your TBI, surgery may be required, typically to remove hematomes, contusions, or of reconstruction surgery. If so, patients are monitored and cared for by the intensive care unit, obviously. And then once the patient is released, if he is capable and able, he may be prescribed or referred to a rehabilitation program or setting. Patients may benefit from a rehabilitation program once time is completed at an acute care hospital. And the prime candidates for therapy I saw were those who showed significant improvement and their injuries weren't as severe, like I said. Rehabilitation programs really focus on the compensatory strategies and aim for the goal of full functionality in all patients. They dial in on that concept of cognitive retraining. That's very crucial in rehabilitation for TBI. So that is really repeating an action over and over again to make that memory really stick in there. That's what cognitive retraining kind of is. And another goal during rehabilitation is to educate and form a relationship with the patient's family. So I thought that was cool too, to see how that relationship can help and promote a better quality of life for the patient when they're at home settings or when they're not in the care of a doctor or therapist. So for the case study, we saw Mr. OT. Mr. OT is a 40-year-old active male who recently suffered a traumatic brain injury. The patient is an active bicycler and exercises regularly 3 times a week. The patient has no past medical conditions, including no diabetes, no recent past surgeries, and no allergies. The patient recently fell off a mountain trail and landed on a pile of stones. The patient suffered a severe contusion to his head and was transported to emergency care. No surgery was needed. However, the patient had a severe concussion and has had some functionality problems on his right side. Due to the time spent inactive and at the hospital, the patient has lost weight and muscle, so is feeling very depressed. The doctor's main concern is gaining full functionality back into the patient's right arm. At times, the patient reports to feel weakness and numbness in his right arm. The patient showed tremendous improvement during his stay at the hospital and has expressed a goal to become fully active again. The patient and doctor will want to begin a structured exercise program. So we started by taking a couple measurements on Mr. OT. I thought the most important one was his heart rate to see where that was at. And it was at 78, which was pretty normal. And then we follow up with a blood pressure, which was 70/110. And then his BMI, which was 22. And then I just included in there the waist and hip ratio, just to get a better idea of Mr. OT, which was 0.8. So all his numbers weren't really out of scale. They were kind of normal and really something that we could work with. So exercise testing. Due to the patient's previous fitness level, he can endure almost all exercise tests. Since the patient is recovering from a concussion and has occasionally faced functionality problems, it's best to choose light to moderate level tests. Due to his functionality problems, it was also best to avoid free weights. Obviously, for safety reasons, we don't want his arm giving out or any weights falling on him or any re-injury happening. It was also very important to test his balance as well, because with TBI patients, they really face a balance, complications in their balance. So for the balance test, we did the one-legged balance test. His result was 15 seconds before he got out of stature. And then the flexibility test was a sit and reach, and his result was 16 inches. Muscular endurance test was a sit-up test. His result was 25 sit-ups. And muscular strength test, we did a push-up test. His result was 12 total push-ups. Cardiovascular test, we did a 1.5-mile walk test, and his result was 13 minutes. So, exercise prescription. The first thing we prescribed was aerobic training. Aerobic training will work on the goal of improving his cardiovascular fitness. The type, we really said he could walk, he could bicycle, swim, something enjoyable for him. The time, we said 20 to 60 minutes, and it could be broken up throughout the day. Intensity, moderate to high, 60 to 80% of his max heart rate, and that increase over time. Obviously, the intensity, we could keep it at that moderate to high, not really do light, because he won't really be doing anything aerobically that may cause a re-injure or anything like that. We said the frequency, he should stick to 3 to 5 days a week. The next thing we did was balance training. Balance training for an individual, like I mentioned, TBI will help with coordination, agility, and muscular strength. Balance training will also reduce the risk of falling and re-injury. The frequency for that was 2 to 3 days a week. And then the intensity, we did the patient's choice. I thought this was a cool thing to include in here because it will promote him to actually want to train if he can pick his own intensity and the type of exercise he does, especially for balance. A lot of people don't want to train that. They want to skip ahead to the muscular strength and muscular endurance training. So it's cool to give the person that option. Type, like I said, we gave him an option, but it can vary from yogas, Pilates to Tai Chi. And then the time was 60 minutes, and that can be broken down. The next exercise prescription that we did was strength training. Like I said, we made sure everything was stable so that re-injury is avoided. Strength training will help achieve the patient's goal of gaining his lost muscle and weight back as well. Strength training will also improve the patient's functionality problems. Obviously, strengthening that right arm, he will gain more functionality in it. He will not be as reliant on his left arm as well. So the frequency, we said 2 to 3 days a week. The intensity, 3 sets of 8 to 12 repetitions. And then we said to start with 1 set of his problems with functionality or any pain occurs. And then the type, we said we want to stick to body weight or circuit machines because obviously we don't want him lifting anything over his head, over his face, or on his back that can cause him to become re-injured. Lastly, we did a flexibility training. The frequency as often as possible throughout the day, obviously. And the intensity, I said to perform a stretch to a point of tightness and never pain. This was really important because as I'm gaining more experience in the rehabilitation setting, I saw that was a very prominent cue by the therapist. The time as well, we told him to hold the stretches to 10 to 30 seconds. Traumatic brain injury can reduce a person's range of motion and can cause stiffness. So regular flexibility training can improve tightness and all that. The conclusion, traumatic brain injury patients, no matter how severe, can drastically affect someone's life. There are many short-term and long-term lasting effects on an individual's life due to a traumatic brain injury. Individuals who suffer traumatic brain injury should always receive immediate care and eventually therapy to return to full functionality. Cut here, my references listed. I thought the Centers of Disease Control and Prevention were really useful. Also, the Journal of Head Trauma Rehabilitation was also very useful. And if anybody wants to check that out, I would say the Introduction to Brain Injury for the University of Alabama at Birmingham. That was a very interesting and informational article as well. Thank you very much. Thank you for watching.